investments in health systems are critical and they are not a cost, they are actually an investment. COVID-19 pandemic particularly, highlighted the importance of various kinds of collaborations and multi-stakeholder partnerships. And rather than recreating and reinventing the wheel every time, we will have to repurpose and repackage what exists. So Universal Health Coverage Day this year is very, very significant because of the theme also. If you see, this year's theme is about leaving no one behind. So Universal Health Coverage Day always has been about, making healthcare systems more equitable, responsive, client-centered, accessible and affordable. And in light of the COVID-19 pandemic, this is even more important because we all saw that in India especially, the primary healthcare systems were at the forefront of COVID response. In fact, they were the fulcrum of COVID response. So this calls for more sustained financial allocations in making healthcare systems more strong and responsive. And that's why I feel that UHC Day 2021, especially with the theme of leaving no one behind and invest more in health systems, is very, very, timely and very, very opportune. So that the message that we all are getting and reiterating is that investments in health systems are critical and they are not a cost, they are actually an investment. So in a country like India, where the population is so huge and the numbers are huge, the scale is very, very high, and also the resources are limited, I think partnerships are very, very important going forward. We all do understand that universal health coverage is a tall order. No one organization or entity can achieve it alone. So COVID-19 pandemic particularly, highlighted the importance of various kinds of collaborations and multi-stakeholder partnerships in public health. So I personally believe that all of us in the sector now do understand that partnerships are the key going forward. And rather than recreating and reinventing the wheel every time, we will have to repurpose and repackage what exists. Only then we can optimize the resources and maximize impact. Ayushman Bharat is the largest government-funded healthcare program in the world. Ayushman Bharat has two very clear components. One, of course, is providing access to quality, comprehensive primary healthcare by establishing and operationalizing a network of 1.5 lakh health and wellness centers. And the second component is about reducing the cost of out-of-pocket hospitalization by promoting access to insurance through the component called PMJY, Prime Minister Jan Arogya Yojana. So, these two components are interlinked and interrelated. And if you see how they've been designed, they themselves are meant to be providing and promoting equity in healthcare by reaching to the last mile and the end beneficiary. Health and wellness centers will be taking primary healthcare closer to the homes of the people, wherein, at every 3,000 to 5,000 population, depending on whether it's a hilly area or a plain area, there will be a functional health facility which will be manned by trained public health provider called a community health officer, along with the primary healthcare team. NISHTHA is a USAID funded flagship program that is implemented in 12 states. Our strength lies in being, technical partners to the governments around the operationalization of health and wellness centers, and also for the operationalization of the school health and wellness program. So given that we have access to these two platforms, we've been leveraging them for dissemination of messages around healthy hygiene behaviors. So in partnership with Unilever, we have a project which is active in these states that we work in. And the idea is that at the health and wellness centers, we target both the service providers for ensuring a better uptake of biomedical waste management and infection prevention practices, as well as the communities who are accessing services at the health and wellness centers through health and wellness sessions, as well as celebration of days like World Water Day, Hand Washing Day, to reiterate the importance of adoption of healthy hygiene behaviors.